Good morning, students. Today's class is from the same unit, that is Unit 4, Altered Immune Responses, and the topic is drug reactions. So we all know that drugs have adverse effect on the body if taken in high doses. Let's see the introduction. All drugs can produce adverse effects. There are no drugs in the universe without an adverse effect or side effect. Adverse drug reaction response is abbreviated as ADR. So these drug reactions are mainly abbreviated as ADR, that is adverse drug reactions. ADR is any injury to the body that is caused by any medications. So whenever the drug is taken in high dose or our body is not reacting to that drug, so we can have possibility of having drug reactions. Now let's see the definition. This definition is given by WHO. So the definition is a response to a drug which is noxious and unintended and which occurs at doses normally used in man for prophylaxis, diagnosis or therapy of disease or for the modification of psychologic function. So any drug which is given to the normal human being for the functioning, or you can say for the treatment, but have any adverse effect or have any side effects, that is known as adverse drug reaction. So this drug reaction is also classified. It is mainly divided into three groups. These are type of reaction, onset of event and severity. So first we are going to see the types of reactions. These types of reactions are divided into 6 types. These types are type A, that is augmented, type B, that is YEAR, type C, that is chronic, type D, that is delayed, type E, that is end of use, and type F, that is failure. Now let's see what is type A, that is augmented. Augmented is related to dose, that is whenever the medicine is taken and it is in high dose, it has chances of having adverse effect on the body. Let's see the features. Commonly related to the pharmacologic action of the drug, exaggerated pharmacologic response. So whenever these drugs have high dose in the body, it can have adverse effect. Then predictable, low mortality. It is predictable, that means you can have you can predict that it can have adverse reaction on the body. Examples are dry mouth with tricyclic antidepressants, respiratory depression with opioids, bleeding with warfarin. These are the drugs and these are the side effects what you can see. Management is reduce dose or withhold drug. Then consider effects of concomitant therapy. So you have to reduce the dose of the drug whenever the person is reacting to it or having side effects. And the next second one is YEAR. YEAR is non-dose related. This can be due to your body immunity. Whenever you have low immunity or any changes in immunoglobulin, then you can have YEAR effects. Features are uncommon, not related to the pharmacologic action of the drug, unpredictable and have high mortality. It has high mortality rate, that means high death rate. Example are immunologic reactions, that is anaphylaxis to penicillin. Then idiosyncratic reactions, that is malignant hyperthermia with general anesthetics. Management is withhold and avoid in future. Whenever you have this YEAR reactions, you should withhold that drug or you should try to avoid it in the future. And the next is chronic, that is dose related and time related. Whenever any drug is taken for long period of time, it can have chronic effect on the body. Features are uncommon, related to the cumulative dose. Then example is hypothalamic pituitary adrenal axis suppression by corticosteroids. Then osteonecrosis of the jaw with biphosphonates. So these are the examples of chronic overdose of the drug. Management is reduced dose or use an alternate day therapy. Then withdrawal may have to be prolonged. So chronic, we know it is a long-term disease condition. So whenever we are getting this chronic adverse drug reaction, we have to withhold the drug or we have to try to give it in an alternate day or we have to reduce the drug dose. And the next one is delayed. Delayed means whenever you are delaying the drug administration, that means you are not giving it on the time prescribed by the doctor. So we are having side effects due to those things also. Features are uncommon, usually dose related, occurs or becomes apparent sometimes after use of the drug. Example is carcinogenesis, teratogenesis, triadrive dyskinesia, leukopenia with lomustine. Management is often intractable. Next is end of use withdrawal. Whenever we are taking any drugs for a long period of time and suddenly we are stopping that drug, so it is likely to have some reactions from the withdrawal of the drugs. That is called end of use. Features are uncommon, occur soon after withdrawal of the drug. Example is withdrawal syndrome with opiates or benzodiazepine. Example, insomnia, anxiety. So these are the symptoms you are going to see in the patient. Management is reintroduce drug with and withdraw slowly. So you should withdraw the drug slowly so that person should not have any side effects. Then last one is failure, unexpected failure of therapy. If you're giving any drug to the patient and patient is having any reactions to it, that is called failure. That is patient body is not reacting to the treatment. Features are common, dose related, often caused by the drug interactions. Examples are inadequate dosage of any oral contraceptives when used with an enzyme inducer, resistance to antimicrobial agents. Management is increased dosage, consider effects of concomitant therapy. So these were the types. Now let's see the classification depending on the severity. So it is mainly divided into 4: minor, moderate, severe and lethal. Minor is no therapy, antidote or prolongation of hospitalization is used. In minor therapy, that is short duration, so it will be treated by its own. You should not treat, it is not needed for any antidote or any severe therapy or for any hospitalization. Moderate requires change in drug therapy, specific treatment or prolonged hospital stay by at least 1 day. So for moderate one, you need to change the treatment what was given before, and in some cases you need to hospitalize the patient also. And in severe cases, when it is life-threatening condition, you need to take serious care of the patient and also need to have changes in the drugs and need hospitalization. Then lethal directly or indirectly contributes to death of the patient. So if the severity line crosses, then it can cause death of the patient. That is categorized under lethal. Then the next one is factors causing adverse drug reaction. What are the factors that can cause drug reaction? So patient factor means depending on the patient, it is age, sex and genetics. Age means that is old age. Sex means females are more prone to have because they are weaker bodies. Genetics means when we are getting these symptoms from our parents. Then drug factors, type A or type B. Type A is drug related and BIZER is immunity related. And clinical factors are duration of treatment, when to discontinue, which drug to be prescribed in pregnancy. So long-term use of drugs can also cause side effects. Then there are some predisposing factors. They are polypharmacy. Polypharmacy means when you are referring so many medications from different doctors. So this can also have side effects on the patients. Then multiple and intercurrent diseases, age, drug characteristics, gender, race and genetics. The next is, now let's see what are the clinical manifestations, that is what are the signs and symptoms you are going to notice. So in GIT, that is gastrointestinal tract, you are going to have nausea, vomiting, constipation, diarrhea, gastric mucosal erosion and ulceration with bleeding. Then hematopoietic, bone marrow depression. Then organ toxicities, hepatotoxicity, nephrotoxicity, cardiac toxicity, ototoxicity, ocular toxicity, CNS toxicity, endocrine and infertility, dermatological toxicity. So these are the side effects you are going to notice in the patients. Then others may have mask, taste and smell changes you can see. Then there are certain investigations you are going to have with the patient. The first and foremost is history collection and physical examination. You are going to have detailed history of the patient to know the reason of side effects, drug reactions. Then you will be having physical examination to notice the signs and symptoms. Then you can go for biopsy, complete blood count with differential. Then serum electrolytes, antibody or immunoserology studies, urine analysis, chest radiography for vasculitis. So these are the investigation. Except these, you can go for skin testing, sprig test, then patch test and intradermal test. These all tests are already dealt in previous classes, so I'm not going in detail. Then come to the management. In management, we are going to see the nutrition support, temperature control. Nutrition support is necessary because the patient should have healthy diet to have a best immune response. Then temperature control means the patient should not have fever, because in those cases the patient is having likely to have more drug reactions. Then wound care, you have to take the care of the wound wherever the drug reaction is excessive. Then ophthalmic care, you have to take care of the eye, and you should use the installation of drops at advised time or as suggested by the physician. Then antibiotics are administered on the order of the doctor, and there are some specific antibiotics, like specific treatments are given, like corticosteroids. I have already told you corticosteroids are given for reduce of inflammation. So in that, oral prednisolone are given to the patients. Then next is cyclosporin. Cyclosporins are given to inhibit the activation of T lymphocytes, which suppresses the immunoglobulin IgG. Then next is intravenous immunoglobulins. It can also can be considered if patient is seen within 48 to 72 hours of bulla onset, and in case with active progressive lesions even after 72 hours. So when there is more risk to the patient, in those cases these immunoglobulins are administered to the patient. That's all for the management session. So in today's class we have seen the introduction, definition, classification. In classification, it is divided into 3 types, that is type of reaction, onset of event, and severity. Then we have seen the etiological factors, clinical manifestations. Then diagnosis. In diagnosis we have seen the skin test, prick test, patch test, intradermal test, and then we have come to the management. In management we have seen for the common management such as nutrition, wound care, temperature control, and certain specific medications. Thank you to everyone.